Having a scar on your face can be a really, really disfiguring thing that you'll continue to think about and continue to focus on. I have some patients that won't even let themselves be in photos because of scars. So what do we do about those scars? There are a lot of different things that we can do, and it comes down to whether the scar has bad texture, whether the scar is discolored, or whether it's just in a bad location, and sometimes all three. So this is an example of a scar that had bad texture. It was very red in a very visible location, like right smack in the middle of his cheek. And what you can see from the before and the after here, the after is showing you 6 months after I did a scar revision where I had cut out the old scar and replaced it with the new one, and lasered the scar a couple times afterwards. Obviously he still has a scar there, but the scar looks much less red, it's much less visible, even though it's kind of in plain sight. And so this is a good example of what a scar revision can do, where I can't just make a scar disappear, but I can trade out a poorly healed scar into a very nicely healed scar. And so usually when it comes to like the easy things we can do for scars, this is where your things like microneedling are going to be helpful. This is where early on, if you just had an injury and you're just trying to deal with that scar within the first year after it happened, microneedling is actually quite helpful. If we just need to address the texture of the scar, laser is definitely the next step up. I can be a little more aggressive in terms of what we're doing to really like kind of smooth out the rough edges of the scar. And finally, if it's a really visible scar in an area that just is extremely cosmetically sensitive, meaning like kind of on your cheek or on your forehead, or an area that is really stands out a lot. Sometimes you have to cut out the scar and just redo it. A lot of times when you've had a traumatic scar, meaning you fell and you cut something open or got pulled open or something like that, that skin was literally ripped open. So even if you had the world's best plastic surgeon put that back together again, it's just not gonna look as good as a surgical scar where it was made very cleanly with the scalpel. Sometimes we do all three of those things, where I will do the surgery and then I laser it afterwards. So it really just depends on the individual scar, but I want you to know that there are definitely options, and it's worth just talking to a surgeon about it.